Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about Frailty syndrome, a problem lurking in Indian community dwelling geriatric population, is Sayoni Dash. Sayoni is presently doing her PhD in anthropology from Indian Statistical Institute, Calcutta, India. Her doctoral research work is focused on elderly health among the rural elderly population of West Bengal. Sayoni's research work is based on Frailty syndrome among community dwelling older adults. In India, only a handful of studies have been focused exclusively on this aspect, but she believes that from the viewpoint of future demographic changes in India, there is an urgent need to examine all the consequences and pathways of this geriatric syndrome. Sayoni is passionate to increase health awareness and improve the quality of life of the elderly population. Thank you for being here today, Sayoni. How are you?
I'm fine, Jason. Thank you for giving me the opportunity to be a part of Knowledgeable Aging.
Excellent. I'm looking
We
forward to
all,
sorry, real quick,
yeah,
before we get started, for those that are joining today, for the live webinar, type your questions in, time permitting. We will do everything in our power to get those questions answered at the very end. So I'm going to turn it over to you, Sayoni.
Jason, we all know that elderly population is increasing around the world, and our life expectancy is also increasing. But there is decline in our quality of life, and it has implications in our public health, our health system, and healthcare expenditure. So, with aging, there are several health-related problems, and frailty syndrome is one of them. And presently, I'm working on frailty syndrome, and today I will try to explain about this particular syndrome, which is quite common among the geriatric group, but it is very complex and multidimensional. Around the world, there are several scholars those are working on this particular syndrome. But in India, and particularly among the community dwelling population, it is very few. And as it is very complex and multidimensional, so that's why we need very clear idea about this syndrome, and we need more study about this syndrome. So before that, we have to know who is frail. The thing is, frail is someone who is very weak, feeble, and sickly. That's why that particular individual needs treatment. And frailty is the state of vulnerability, when an individual can experience loss in physical as well as psychosocial domains, and it also associated with several adverse conditions like cognitive decline, disability, falls, hospitalization, and even death. Now, we all know that frailty is a syndrome, but why it is not an illness? Because when we talk about this illness, it is basically come with a disease, an abnormal condition. But syndrome is an accumulated effect of impairments in multiple domains that together result in a particular adverse outcome. So that's why frailty is a geriatric syndrome rather than a illness. So how we differentiate between a frail elderly and a healthy elderly? The thing is, frailty is a transitional stage between a healthy elderly who is independent and a elderly who is dependent. So it is a transitional stage between these two. Another misconception about frailty is most of the people think that all the elderly people are frail. That is wrong, because all elderly are not frail or will be frail, because it is not a byproduct of aging. Rather, it is associated with aging. It is like there are several reasons which is associated with frailty, and it is one of them. But we can't use in a synonymously aging and frailty. So now, how could we measure? How could we screen frailty? The very first screening scale for frailty was proposed by Fried in the year of 2001. But from 2001 to till today, there's like 67, approximately 67 scale for the frailty, for screening the frailty, and among them, like 9 are very well approached cited scale, but there is no such gold standard method for frailty syndrome to screen the frailty syndrome. So we have to think that what scale should we use. So today I will explain about a particular scale which is most cited scale and the first scale for frailty syndrome, which is Fried Frailty Phenotype Scale. And they use the term phenotype because it is based on observational method, and this particular scale is also known as physical frailty scale because they use the term physical because it is depend upon five physiological deficits, like five are shrinking. First one is shrinking, which is based on weight loss, and it should be unintentional weight loss. Another one is weakness, which is based on grip strength. Third one is exhaustion, which is based on a particular question. Then fourth one is slowness, which is based on walking speed, which is normal walking speed. And the last one is low activity, which is also based on a question. And they explained that, they highlighted that if anyone have at least 3 or more than that out of these 5 deficits, 5 physiological deficits, then the particular individual will be denoted as frail. And other than that, if anyone have at least any one or two out of these 5, then he or she will be denoted as pre-frail. And other than all that, all the people are non-frail or robust. There is a reference of this particular paper which will explain all the details of this particular scale. The thing is, this is a very important and benchmarking study for frailty, and I wanted to put this particular slide because it will show that from 2001 to till now there are increasing. There are several studies, those are based on frailty syndrome. Like in 2001 it is just 415 works, those are focused on frailty, which is like now 6,500, which is quite high. But if we compare this number with other studies which are based on other conditions like obesity, like hypertension or diabetes, then the number will be very few. So we have to think that as a multidimensional syndrome, we need more studies. But till now, there is not that much increase of studies. We in a whole, we want more studies for frailty syndrome. Now, another thing is, how could you choose a scale? Should we choose a scale based on the number of citation, how it is applicable or not? So we have to think that we have to choose our frailty scale based on our objective. Obviously, how much cited it is, how well appreciated, that matters. But still, we have to think that it should be based on it should be applicable on your population. How what is your objective? So we have to think several things before choosing a particular scale, because there is no gold standard method. So for India, recently I am working on frailty syndrome and I am using Pride scale in a modified version. Like there are several things like questionnaires. Those are mostly focused on Western countries, which is not applicable. I can't apply that in our population, our community dwelling population. So I have to modify that. So in that way, you have to choose your scale, or you have to modify it on your own way. Then you have to validate it in your population. For India, I only found this particular scale in 2014. Chatterjee et al. They proposed this particular scale, which is based on 3 aspects like major, minor, and essential. And the major aspect are based on 3 domains. Those are slowness, strength, and endurance. Then the minor aspect, which is based on energy, mood, and nutrition assessment. And the essential one is IL-6 level. And it is a very good marker for to understand any inflammation or not. But the thing is, if you want to apply this particular scale in any hospital setting, then this scale will be fine. You can use that scale in Indian population. But if you want to use in a larger community or in a community dwelling population, then it will be very difficult, because the availability and cost of assessing this particular IL-6 level is very difficult to conduct this study in a large population. So that's why we also need a scale which we can use in our Indian community dwelling population. So before choosing any scale, you have to take care, you have to think several things. Now, the prevalence. Uh, the prevalence of frailty among community dwelling population varies uh, enormously around the world. Like, it is 4% to 59.1%. In Western countries, it is like 4 to 10%. In United States, in Italy, it is 6.5%. In France, it is 7%. In United Kingdom, it is 8.1%. But in India, the studies are very few, but the largest and most comprehensive study on frailty was conducted by WHO in the year of 2007 and 8. This study is a multi-country study which was particularly based on low and middle income countries like China, Ghana, Mexico, Russia, South Africa, including India. And they highlighted that prevalence of frailty in India has the highest, which is like 56.9%, which is quite high. And they also pointed out that women generally had a higher frailty prevalence in India. Both education and income are protective factor for frailty in Indian population, and frailty is significantly associated with food insecurity, depression, and it deteriorates our quality of life. But after that, after this particular study, there are very few studies. Some studies are based on several communities, and those are cross-sectional studies. Like, India is very heterogeneous country. They varies very differently. Their culture, their food habit, they are very different from North India to South India, and Eastern India to Western India. So we have to study. We can't sum it up as a whole. Like, we can't say prevalence or any associated factors as a whole. So we need community specific studies. But I found that from 2016 to 2020, there are like 5 or 6 studies. So we can't generalize that way. We this slides explain that we need that more studies in a community basis. But these studies showed that prevalence of frailty was 26 to 38%. They also found that women are vulnerable to frailty. Those have very low education, lower socioeconomic status, they are also vulnerable to frailty. Fear of falling, not going out, history of fall, hospitalization, economic dependency, all are associated with frailty syndrome. And frail and frail individuals both are reported very high social isolation, and it is also associated with chronic and degenerative diseases. But as I mentioned earlier as well, it is very complicated. So we need more studies to understand all the associated factors. So we can say that frailty factors tipping an older person from very low to high risk and put them need of enhanced level of care. So keep in mind the fact that our population is age is increasing, our life expectancy is increasing. So keep in mind all the factors. We need proper strategies to prevent frailty, and for that we need adequate information. And it is obligatory for at least not only for India, for all developing countries, for the policymakers to have a very clear idea about this multidimensional syndrome. Conceptualization of frailty only can help to improve our quality of life, and it also help one of the very important factor that it will help to reduce future healthcare expenses. So it is high time to understand, to provide a social awareness about this syndrome, as much as focus on we are giving other conditions like obesity or hypertension or diabetes. Another thing, it is specifically for Indian population, uh, the geriatric outpatient department services are available only in a tertiary care hospitals. But in India, like 75%, approximately 75% of elderly people are residing in rural areas. So it is mandatory that geriatric healthcare services made a part of primary healthcare services. This may help to prevent or early diagnosis or delay frailty syndrome. The thing is, we can manage frailty. It is reversible. Uh, but there's some issues like if we found that anyone is frail, then it will be little bit difficult to reverse it as a healthy elderly individual. So it will be better if we diagnose it earlier. If we found that anyone is pre-frail, then it will be easy to manage, or we can intervene this and we can reverse that person to healthy elderly individual. So there are also some studies, there are literary evidences, those are based on several interventions, and those are specifically focused on physical activities, nutritional fortifications, or cognitive therapy to treat this particular frailty. If anyone want this all the details of that, I can provide you all the papers regarding this. Another thing is the development of basic research on different aspects of frailty syndrome is important, and obviously we need a better and simple methodology for screening and identify the frailty and pre-frail status of the elderly population. So I think basic thing we want is the awareness. Most of the people are not aware about this particular syndrome, which is like very common. As there are several studies, those are based on hospital setting, but in community level the awareness is very low. We need awareness of researchers as well. Those are mostly working on geriatric population. So we need the concern of the researchers, of the policymakers, as well as our administrations about this particular syndrome, to keep in mind that uh, otherwise to keep in mind the epidemiological challenges. Otherwise it will be very difficult in future. Thank you, Jason.
Very good stuff, Sayani. Question for you. You mentioned here the intervention that should be done. So if I'm thinking about policymakers in India, what types of strategies are in play or thinking of being in play when it comes to reaching that 75% population that is rural?
The thing is, it is possible. Like I'm saying that we need, the basic thing we need is the awareness, because we can conduct several awareness program in rural areas. There are some primary healthcare programs already conducted by the governments in the rural areas. So if you want to aware people through the hospital workers, so we can do that way. We have to aware people about their physical activities, about their uh, about their diet, or there should be some therapies regarding the cognitive factors or like that. So we most important thing is the awareness.
Yeah. So let's talk about COVID. Obviously, right now we're living through an unprecedented time right now. When you think about frailty syndrome, what association do you have between that and where we are with COVID?
uh, I, I I just forgot. I just missed the thing. I wanted to explain it as well. So anyway, it is a very good question. Uh, we all know that in COVID, it is associated with aging population. They are very vulnerable. And as per the statistics of last 8 9 months or 10 months, that the prevalence of COVID and the death rate is quite high among the elderly population, and several people think that it is a the aging problem, which is not. COVID can affect anyone, but the thing, when we talk about the frailty, there are some literary evidences. I found it like from last few months. There are some work. They explain that those are frail. They are very very vulnerable to COVID. So if you are aware about the fact that you are frail, or your any family member are frail or pre-frail, so you have to protect them in a very different way. So there is association. It is well proved that those are frail. They are vulnerable to COVID.
Yeah. So early on, you talked about what is frail, what is frailty. So when I think of frailty, you said it's almost like it's a step between. Um, so when you think about potential symptoms such as like if you have comorbidities or disabilities, how how do you differentiate between multiple comorbidities, if you will, disabilities, frailty? How do you differentiate between the three of those?
Uh, in many times people think that we can use these three terms in the same way, which is
Right.
not. There is an association. They are overlapping with each other, but they are different. And there is a well proved association. There are several scholars and Freud as well. They explained in a way that if anyone is comorbid, then he or she will be vulnerable to frailty. And if anyone is frail, then that particular individual is vulnerable to disability. So in that way, they are associated with each other, but we can't use it in a same way.
Yeah. A question just came in and says, what can one do to help an elderly mom or an elderly family member? They said, my mom has some balance issues, terrible insomnia for years and years, also exhaustion. I've put her on some supplements. You know, what can we do?
The thing is, first we understand that uh, he or she is frail or not. For that, we have to measure. Like I've talked that there is a 67 scale for frailty, but there's another scale. It is termed as I forgot the name. It is for feet frail scale, pictorial feet frail scale, which
Okay.
is particularly for the caregivers. If anyone in our family is, we are suspecting that he or she might be frail, we can use that particular scale by ourselves. It is like 5 minute scale, and which is based on pictures. So for that, we can use that, and if we found that he or she is frail or pre-frail, we can we have to do some management program, we or intervention program. For that, we can use that scale, which is very useful for a caregiver. So if anyone want that particular scale, I can provide the scale, which is also well cited. And that particular scale is not we can use it in research purpose, but the main focus is for the family members and for the caregivers. So this is a very good scale.
Uh, Last question. You talked about the Freed scale regarding shrinking. How do you determine shrinking when you're talking about weight of a family member?
uh, if the family member, like in my family, parents or grandparents, they are aware of their weight, so we understand that it is increasing or decreasing. But I'm facing, I faced several problems regarding this particular thing. Like, I am working on rural areas, and in India, in community level, if you think about particularly in rural area, there's like 99% elderly people are not aware about their weight. So in that case, I am using it in a modified version. I'm not taking the weight loss or shrinking. I'm using it in a manner like it is for low weight. Like I am
Okay.
calculating their BMI, and from that I'm calculating that he or she is low weight or not as per the community, as per the study population. So I'm doing it in a modified way. So for family member, it will be easy because in my family they are aware of their weight. But if anyone is not aware of their weight, another thing you can do it in a like 6 month gap. If you first take their weight now and after 6 months then again take their weight, in that way it is possible. Otherwise, if you are doing cross sectional studies, then you have to modify it in that way.
Yeah, it's funny. Somebody said they'd like to get that scale. They missed your answer about that. So what I'll do is I'll connect you with the gentleman, the individual that had the question for the scale. That way you could get that to them.
Okay.
This has been enlightening stuff, Sayana. I really do appreciate your time. How can people find you?
uh, I'm quite active in social media, so anyone can mail me at my email ID, which is das.shani, SAYANI 6 at gmail.com. Otherwise, I'm also quite active in LinkedIn and Twitter. Both are the ID is Shani Vidas, which is SAYANIVDAS. Otherwise, you can ping me at Instagram as well, which is Shiny Dash official, which is SAYANIDAS official.
Very good. Actually, to the individual who had that question, if you just wanted to jot down Sayoni's email right there and just reach out to her, I'm sure she'd be happy to do that. This
Yeah,
webinar, This webinar will be on our YouTube page later this week. So I encourage you go to Knowledgeable Aging, go to YouTube, type in Knowledgeable Aging, and subscribe, as we have quite a few webinars each week that we upload. You can go to Spotify or Apple Tunes. You can find all of our podcasts there. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.